Hi, thank you for joining us for the PTSD Awareness webinar today. We are here to discuss an overview of what is post-traumatic stress disorder, signs and symptoms of post-traumatic stress disorder. What can you do if you are experiencing the signs and symptoms of PTSD and or your family members are experiencing it? And just overall to raise awareness of post-traumatic stress disorder during this month, which is PTSD Awareness Month. So again, thank you so much for joining us. We hope that this is informative for you and that you will join us again for future webinars. The disclaimer of this is that I am a licensed clinical social worker. My name is Katherine Castelo, and I work with Safe Veterans collaboratively to help bring programming such as this webinar and other resources to you. All views presented in this webinar, though, however, are mine. I have put together this presentation. And so these are my views and are not opinions or those of the entities which I'm here working with or have been affiliated. So PTSD, we hear this a lot, especially it's in the media a lot. We hear it a lot around combat veterans. It's a term that luckily these people are more familiar with and are aware with. But what is PTSD? Well, it is a mental health condition that is triggered by an event. And after experiencing this event or witnessing it, your symptoms may include flashbacks, nightmares, severe anxiety, uncontrollable thoughts about the event. And I say often, and I will say it often through this presentation, a lot of times these symptoms are normal reactions to abnormal circumstances, situations or circumstances that we are experiencing or have experienced that are beyond the normal. And these can develop after a person's experienced the event. But it's commonly associated, like I said, with military and veterans who've experienced combat, but it can affect anyone who has gone through a traumatic event. So anyone in the population around the world can have PTSD if you've experienced something like a natural disaster, an assault of some sort, been in a traumatic severe accident or any kind of an accident, or had the loss of a loved one. Traumatic loss and traumatic grief is a real thing. So if you lose someone suddenly, particularly in a traumatic way, but there are also this PTSD associated with loss overall. So not all military and veterans have PTSD either. So just because you know someone that is military or veteran and has served, and a military or a veteran who has served in combat or in an environment where you think they might have PTSD, that is an assumption that they would have it. Not everyone does have PTSD, and not all military or veterans have PTSD. So there are some terms around PTSD that float out there. We've got post-traumatic stress disorder, which is the diagnostic and statistical manual's diagnosis for what it is called PTSD. Post-traumatic stress is another term that is used a lot. The post-traumatic stress disorder, the D has been dropped very much along some high-ranking officials in the military, around anti-stigma campaigns, to really make sure that people are focused on the post-traumatic stress part of it and not the disorder part of it. The PTSD part of it is part of the diagnostic and statistic manual that is used to diagnose PTSD. But PTS is a term that is affiliated. They are interchangeable. They mean the same thing. Invisible wound. So PTSD is not something that is visible, such as a physical injury you may have. If you have something that is an injury from a traumatic event, you can physically see the injury associated with it. But PTSD is also known quite often as the invisible wound because it exists in your mind and in your body. Quite honestly, you hold the stress from PTSD in your body. It affects your sleep. It affects your anxiety, your depression, your relationships and interactions, but it is invisible. And it's not something that you see outwardly. And then there is a term that's come about a lot called moral injury. And PTSD and moral injury are not the same. But moral injury is a distressing psychological, behavioral, or sometimes social or spiritual aftermath after an exposure to an event which compromises your moral beliefs. And this could be acting or witnessing behaviors that go along with a certain circumstance. So a person may have PTSD and moral injury, And they may have PTSD, but not moral injury, and moral injury, but not PTSD. So it is different than post-traumatic stress disorder. And it is a new term that we will in the future be doing other webinars on to give a better understanding about what is moral injury. But a lot of times moral injury and PTSD flow up very closely next to each other because it is generally the action or inaction taken in a circumstance. So a lot of the symptoms may be prevalent, such as those similar to PTSD, where you're having the negative thoughts, the anxiety surrounding it, the constant moral conflict with it that's giving anxiety, depression, the coulda, shoulda, woulda, what ifs thoughts around it. So moral injury is real, and it can go hand in hand with PTSD, or you can have either or. And again, it is a relatively new term, but it is something that is good to be aware of in conjunction with PTSD. So this is PTSD Awareness Month. And in service of this month, again, we really thank you for joining us. This month is about raising our awareness on PTSD and helping to reduce stigma. Again, PTSD is a normal reaction to abnormal circumstances. So this is something that if you have witnessed a traumatic event, been through a trauma that has given you signs, symptoms, and PTSD, it is something that is treatable. And we hope by educating people that people will be able to reduce stigma, promote further education, seek treatment, and know that there is a supportive community out there. But also hoping to raise awareness with families and friends who are surrounded by a loved one who is working through the journey of PTSD, and being able to help them know signs, symptoms, and what they can and cannot do to be supportive. So we appreciate that this month highlights PTSD awareness. And again, we're appreciative to be bringing this webinar to you during this month. So it's also important to remember that many people go through traumatic events and they may have had temporary difficulty adjusting and coping, but with good self-care, understanding the signs and symptoms, getting treatment, they don't develop PTSD. So just because you witness a traumatic event, you may have a normal reaction to the abnormal circumstances up front, but it does not progress until what we call post-traumatic stress disorder. However, if the symptoms get worse and they last for months or even years, and they're really interfering with your day-to-day functioning, you may have PTSD. And it's really important to get an effective assessment and a treatment after PTSD symptoms have developed, because this can really help reduce your symptoms and improve your normal day-to-day functioning. And again, as I said, I will say it over and over again, it is a normal reaction to an abnormal situation. So we are reacting to a situation that is not in our everyday norm, and our body and mind react to this trauma. And in that, we can get stuck in the healing process. So it's important to note that if you get stuck in the healing process, there is treatment, there is support, and you can work through this journey to get better. So post-traumatic stress disorder may start within a month of traumatic events, but sometimes symptoms don't appear until years after the event. And these may cause significant problems in social relationships, work situations, or relationships, and they may interfere with your ability to do your normal daily tasks. So, one thing that can happen is you will experience a trauma, and then you will have another trauma that triggers that trauma that was from the past. So it compounds. So this can happen, just to have that awareness. The symptoms are usually grouped into 4 types with PTSD. We've got intrusive memories, avoidance, changes in thinking and mood, and changes in our physical and emotional reactions. And these can vary over time, and they really are as unique as individual as each person is. They vary from person to person. So what are some of the intrusive memories or thoughts that may happen? Well, the reoccurring, unwanted, distressing memories of the event, going over and over and reliving the traumatic event as if it were happening again, the flashbacks, truly going back to the situation, dreams or nightmares about the event, and severe emotional distress or physical reactions to something that reminds you or triggers that traumatic event. There's avoidance symptoms. So trying to avoid thinking or talking about it, avoiding places or activities or things that remind you of the event, and triggering. So avoiding altogether in order to not have to associate with that event. negative mood, or changes in the way you're thinking, negative thoughts about yourself, about other people in the world, hopelessness about the future, having memory problems, having a foggy brain, remembering or including certain aspects of the traumatic event, um, difficulty with close personal relationships, which we will touch base on again later in the webinar as well. But PTSD really does have the ability to impact close social and personal relationships. And feeling detached from your family and friends. So that's another part of really impacting that social and emotional relationships. And just total lack of enjoyment in activities that you used to enjoy, having a really hard time getting in touch with those positive emotions, and really starting to feel maybe emotionally numb. You all may be startled easily or frightened easily, more guarded for danger, do more self-destructive behavior. A lot of times those with who have been through a trauma do kind of the adrenaline-seeking behavior, driving too fast, risk-taking, and then also substance use and PTSD really go hand in hand, because people want to try to self-medicate, try to mask those symptoms and those negative feelings. Trouble sleeping again goes along with those nightmares and the difficulty with the dreams and the night terrors, irritability, overall angry outbursts or aggressive behavior, and shame and guilt, which is one of those emotions that also ties in closely with moral injury. Because of the situation, the shoulda, couldas, what ifs go in tie with PTSD as well. And just the overwhelming feeling of shame and guilt can really evoke those negative emotions. That may also come about in children under 6 that have experienced a traumatic event where they go into reenacting the event. So they may react differently than adults. They may try to, you may see them through play, reenacting the event, or they may be having frightening dreams when they go to sleep about the traumatic event. So it may mask a little bit different in children than adults. And PTSD symptoms vary in time and intensity. You may have more PTSD symptoms when you're stressed in general, which is very common. Again, you may have a balance that you've come up with to maintain your PTSD symptoms, and then you have another traumatic or negative situation, which is a stressor and it impacts it and triggers it. So also you may have a situation that is really just like something that triggers like the backfire or fireworks or a certain loud sudden noise that startles you and brings you back into this because it's a stressor for your body and mind that triggers it. Or if you've experienced a sexual assault, you may be triggered if you are watching the news and you hear about something else happening, and then it triggers your own experience. This is all very normal with PTSD symptoms. When do you get treatment? So if you're really noticing, again, an initial traumatic event, there is a time period when, of course, you're having a normal reaction to abnormal circumstances. And it's good to recognize that and process it. Again, though, getting treatment early on really can help mitigate those negative symptoms that we just talked about, or those symptoms that can really impact your daily life and social and emotional personal relationships. If you're having ongoing feelings, or any of these symptoms for more than a month, and if you feel like you're having trouble kind of getting back to where your normal balance was, please reach out and speak with your medical doctor or a mental health professional, because getting this treatment as soon as possible really does help you in the healing part of that PTSD journey. This is really important to note because a lot of times people will get stuck in that stuck point of a thought or feeling or trigger. And it can lead you down a path where if you're having suicidal ideation or symptom, it's important to treat this. I always say suicidal ideation is like if you're having heart attack symptoms. Now, if you're just having like the thoughts and you're kind of in that space between it being the crisis, you're probably having what I would say leading up to having the heart attack. So you need to like really treat it seriously, reach out for help, use the 988 suicide crisis line. It's 24/7, 365. You can chat with anyone. Again, getting effective treatment can really be critical in reducing these symptoms and helping you from getting to this point. Not everyone who has experienced PTSD becomes suicidal. That's important to note as well. But it's also important to note that it can happen. And if you know someone who is in danger or at this point, or what I call the heart attack phase with where they are, you take it as seriously as you would, and you call 911, you get them to the emergency room, and or, always have that 988 suicide lifeline. You can call, text, email available, but reach out and get help. And you can get post-traumatic stress disorder. The causes vary, but you can get it when you go through, see, or learn about an event involving an actual or threatened death experience. It could also be serious injury or a sexual violation. So again, we know a lot of, an accident, a traumatic accident or a car accident could be a PTSD trigger, traumatic loss of someone, being involved in something that is either an actual death or a perceived death, where you are feeling that your life may have been in danger. Then again, serious injury triggers it. So, and doctors really aren't sure. There's a lot of studies out there about why do some people develop PTSD and why do some people not. And there's been a lot of military and veteran studies around this, because some people will go into combat and be in the same experience, and some people will have PTSD and others won't. And there's a lot of different reasons for it. And it could be a complex mix of things, because again, we're each as individuals, our own personal journey roadmap is. So, but there are some things they do know. Stressful experiences, including the amount of time or the severity of the trauma you've gone through, not just in that experience, but your overall life. Any other mental health risks. So you may have a family history of anxiety, depression, etc. All of these things can be genetic, and it may just be a predisposition that may make you more susceptible to PTSD. Other features of your personality, that are your temperament and how you process and deal with stressors. And then again, your just physical makeup, the way your own brain regulates chemical hormones in your body in relationship to stress and the stress response. Because the PTSD, the traumatic experience, really does invoke the stress response, which we do know physically changes the neural pathways in the mind and has an implication on the body. So just keep all of that in mind. It really does vary individually, and there are several causes, and it is a complex mix of things. We know some of the risk factors for PTSD do include things like intense, long-lasting trauma, so trauma that's ongoing, having experienced other traumatic events in life like early childhood abuse or early childhood trauma, having a job that increases your risk of being exposed to traumatic events over and over again, like military personnel and first responders. If you're a first responder and you experience something that is traumatic and it particularly triggers something from your past, and then the next day you're expected to go out on a run where you're also doing something more traumatic. Same with the military personnel situation, where maybe you are in combat or you're in a situation where you are more likely to be put in a scenario where you're experiencing the traumatic event over and over again, or similar circumstances. Having those other risk factors, like we said, anxiety or depression, substance abuse and misuse, again, can go hand in hand with PTSD. We do know that that can be an included risk factor for developing it. Lack of support system. So if you don't have a really strong family or friend support system, that can be also a risk factor. And then having, any relative that has some of the genetic predispositions with anxiety, depression, because PTSD really can trigger both of these conditions. The most common events leading to PTSD include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with an episode or an accident. And we also know that, again, physical abuse ongoing is also a PTSD trigger. So these are some of the most common examples of PTSD triggers and events that lead up to them. So many other traumatic events can lead to PTSD, though. A fire, a natural disaster. We do know, like with COVID, people having sudden loss over COVID and not being able to visit loved ones in the hospital, and having sudden onset of severe illness. We do know that this has caused some PTSD. But again, natural disasters, hurricanes, earthquakes, flooding, mugging, robbery, plane crashes, any kind of torture, kidnapping, life-threatening medical diagnosis, terrorist attack, mass shootings, and other extreme life events that cause traumatic loss. So while we know this is a complication, I do want to, again, talk about the fact that you can get on a healing journey, but we do want to highlight some of the things that can happen and be disruptive in your life from PTSD. It can impact your career, your job, your relationships, your physical health, and your enjoyments of your everyday life. And again, that awareness can help you reach out, get support, and get you on a healing path. Having PTSD may also increase that you will have depression, anxiety, issues with substance abuse or alcohol, eating disorders, suicidal thoughts or actions. So just again, to have an awareness of some of the complications that can come about with PTSD. Some of the things you can do to prevent it. After surviving a traumatic event, you might have fear, you might have anxiety, you might have depression, you might have guilt. Again, these are all normal reactions to a trauma, and it's an abnormal circumstance that you do not normally experience. And again, the majority of people who are exposed to trauma do not develop long-term PTSD. But getting that timely help can really prevent your reactions from getting worse. And they may also help, you get better quicker. So, being able to reach out to family and friends who will listen and offer comfort, seeking out to mental health professionals, learning about PTSD, educating yourself, turning to your faith-based community if that's something you do for support, but really reaching out to your support systems and knowing that, like, if you had another condition that you needed to seek treatment with that was a physical ailment, you would get help with it. Do the same with PTSD in a traumatic event. And support from others may prevent you from developing more unhealthy coping mechanisms, which can actually delay your healing. It's also important to note, as I mentioned earlier, that your PTSD, if you're experiencing it, and or if your family members are experiencing it, it affects the whole family and friends. And if you owe anyone close to you with PTSD, you know what it means. And it makes it really hard for everything day to day to be met in a family. And there could be competing unmet needs. There could just be the inability of the person with PTSD to do basic things within the family unit. And so partners and children may feel more stress, and talking to each other may be tough about it. So these are important to remember. Also remember, you're not alone, and there's a lot of support resources out there. And PTSD can make it really hard to be around one of your friends or family members that you love, because this person may be easily startled, have nightmares. I've had people with PTSD within relationships talk about, like, the night terrors really become physically a challenge for the other person. Like it could become even dangerous. And so how that impacts and how there has to be an understanding and support there. But the awareness is really important. Also, the person you love, or if it's you may be avoiding social situations. And so you may not want to be involved in anything outside of the family, or be very much on your own within the family. So it just is important to have this awareness, because it can have an impact on family and friends. And again, knowing this, having the awareness of it, and knowing where to turn for support. And always remember, you can't change someone. Whether it's you with PTSD, others cannot change you. You're responsible for seeking the support and being actively engaged in your treatment. And if you're the family members, you can't change that person, but you can do these things. You can learn about PTSD and understand what they're going through. Again, awareness can really be an empowerment with that knowledge. Recognize that their avoidance and withdrawal are not personal to anybody else. They're a part of the disorder and part of this, the symptoms they're experiencing. If they resist your help, give them space. Let them know they're available when you're ready, or that you are there for them and you are there to help them on the journey to seek support systems. But again, ultimately, that person has to do it. You can offer to attend medical appointments for them if it's helpful, if they're feeling overwhelmed. But if your loved one is willing to attend and attend the appointments with them, you can certainly go and attend and assist with their treatment in any supportive way. and be willing to listen. Let your loved one know you're willing to listen. You're there. You may not have walked in their shoes. You may not have experienced it, but you do understand that they are going through this experience and that you are there to support them. Try not to force them to talk about the trauma until they are ready. This is really their empowerment, but giving them that space also to have the ability to talk about it when they are ready to do so. Encourage participation. Plan opportunities for activities with family and friends, and celebrate good events. Make your own health a priority. Seek help if you need it. If you need help to be able to be there for your family member, make sure that you are getting the help you need, and stay safe. Again, it's always important to know that you and your loved ones need to be safe, and always have that safety in mind. We also know just Vietnam veterans, as a research study, have had more challenges at times with families and more distress. The PTSD is still real for Vietnam veterans, even though, again, it maybe have been years, but also just to have this awareness and that there is support out there for everybody. And it may be causing those suffering with PTSD to have a hard time feeling emotions. So they may really be a hard time. They may be numb, maybe feel detached or dissociated from things. And we know this can cause problems in personal relationships, because even though it's not personal to you, it may feel personal. And so it also can have an impact on children, because children may not have this understanding. So the numbing and avoidance that occurs with PTSD can have its challenges. There's a great guide at www.ptsd.va.gov on the family support and resources available. And I highly encourage you to take a look at it if you or a loved one is dealing with PTSD symptoms and on the healing journey. It does help give an awareness and lets you know you're not alone, and there are support resources out there to help you through it. There's also a great va.gov support video for family and friends that I encourage you to take a look at. How PTSD affects people you love is also on this site. And living with someone with PTSD can take tolls on relationships. It doesn't just affect you, it affects everyone around you. Having that awareness can be an empowerment to help everyone work through it and do what they need to get the support resources. But this is an excellent guide to go to for more resources and information. Effects on children and parents with PTSD. We know that it can have a wide range of effects. Children may not understand what is happening or why it's happening, so they may worry about that parent, and they worry about if that parent can't take care of them. Children may feel that their parent doesn't care about them because they're avoiding and numbing, and parents on edge may seem angry or may see like they're taking it out on children, and because children maybe don't have the total understanding of what's going on with the signs and symptoms. Again, this is an awareness, and I encourage you to use those guides for support resources. And a parent's symptoms are directly linked to a child's response. So a child may respond, and this is just for, again, awareness that children may feel like if they behave just like their parents want, trying to connect with the parent will improve things. They may show some of the same signs and symptoms as a parent. The child may try to take on the adult role to fill those gaps because they feel like they need to take that on and ease the burden for the parent. And say some children may not do not get help with their feelings, so it might come out as sadness, worry, anxiety, fear, etc. So this again is the support impacts on children in PTSD as parents, and just having a greater understanding of how you can get support. And having awareness of how it may impact your child. So let's go to treatment. What can we do if we have signs and symptoms of PTSD after a traumatic event? Well, a diagnosis is required via assessments after exposure to the event in order to determine it. The Diagnostic and Statistic Manual has criteria for the diagnosis that you directly experience the traumatic event. You witnessed it in person, the traumatic event occurred to others. You learned someone close to you experienced or was threatened by the traumatic event. You're repeatedly exposed to graphic details of traumatic events again, for example, if you're a first responder to the scene of traumatic events and you go repeatedly on that scene or similar scenes. What we do know is that treatment can help you regain a sense of control of your life. And there are some primary treatments for PTSD. You also may need a combination of medication and therapy, as well as other support symptoms. And your treatment will be as individual as you are. While there are some recognized treatments that work well, what works well for you is going to be individual for you, and in conjunction and collaboration with your healthcare provider and your therapist, and or your support systems. So teaching you to address your symptoms is important, helping you think better about yourself and others in the world. So changing the cognitive thinking, learning ways to cope when the symptoms arrive, and treating any underlying symptoms from it, or issues that are in conjunction: depression, anxiety, substance use, etc. These are some of the therapies that work. Several types of therapy, also called talk therapy. It may be used to treat children and adults. But some of the evidence-based treatments that are used, and they're used in most clinical private settings and or the veteran affairs if you're going to use that for your treatment. Cognitive therapy works. There's also cognitive processing therapy, and it's sort of talk therapy that helps you get through your cognitive patterns, and they also really help you find your stuck point. It focuses on the negative beliefs and the risk of traumatic things happening again. It also helps you with those cognitive thoughts. And exposure therapy is a face-to-face therapy where there is an element of exposure to work through the different aspects of PTSD symptoms. EMDR combines exposure therapy with guided eye movement, and a lot of people have really liked this therapy for PTSD and being able to process the trauma thoughts. There's written exposure therapy, which helps you find new ways to think about your trauma and meaning through writing assignments. Stress inoculation therapy, teaching coping techniques to help you find new ways to manage symptoms in your life. And then present-centered therapy, learning how to deal with current life problems related to your traumatic experience. And then in conjunction with talk therapy, sometimes people do need medication and to help with the symptoms, whether it be antidepressants, anti-anxiety medications, and other medications. Again, this is in close collaboration with your medical doctor, but these are some common medical medication treatments for PTSD. These can help, again, alleviate the symptoms while you're working through and in conjunction with the cognitive processing. It's important to note that one type of treatment does not help everyone, but also sometimes there are shorter term treatments that happen. So there are things that they're trying to get away from using more of, like benzodiazepines and other medications that can have a long-term addictive effect. They are used to take off that panic reaction, but in long-term, they're recognized they can be addictive and cause other problems. So again, work very closely with your personal provider when you are working with what you need for your mental and physical health. And another thing you can do before you're going in for either a assessment with a medical provider or a psychotherapist, you can make a list. Part of your being proactive in your healing journey is you can make a list of things to, like you would with any physical health condition. What are your signs and symptoms? How long have you been experiencing them? Key other information, events or experiences that have made you feel intense fear, hopelessness, or horror. Talking about any triggering memories, anything that you are comfortable bringing up. But again, the more information you can provide can be very helpful. If you've done avoidance, what are things you've stopped doing because of stress? Any medical information that is helpful, any other diagnoses, medications you're taking, questions to ask. So if you have questions, write them down and be prepared for your appointment, and follow your treatment plan. So people will feel better almost immediately, but it's important to follow your treatment plan with your provider and work very closely and collaboratively with your provider as an advocate, working together towards your healing journey. And before your appointment, educate yourself to learn about PTSD. This can help you understand what you're feeling and develop coping strategies. Take good care of yourself, like with any situation. Get rest, eat healthy as you can, exercise, take time to relax, try to and avoid and reduce caffeine or anything that is going to provoke your anxiety. Be cognizant of self-medicating with drugs and alcohol. A lot of times this goes hand in hand to try to numb or avoid the feelings as a way to cope, but it may lead to further problems down the road. And it may actually impact effective treatments and prevent a real healing process. So try to break the cycle. It can be challenging to do, but when you feel anxious, take a brief walk, jump into something that you enjoy. I like the insight timer or the calm app for a 5 brief, quick meditation. Box breathing is something you can go to that is excellent. And you can just, you can even YouTube box breathing, and it is excellent for focusing on your breathing. And then I had someone recently remind me of a recent discussion of you can't feel gratitude and anxiety in the same moment. And while it may be brief, if you're in a really highly anxious moment, like thinking of something you are grateful for actually does shift it. So again, if you're feeling that high anxiety, do little things for self-care to try to break that cycle. Stay connected. Look to people who are supportive and caring, friends, family, faith leaders, and others can help you. And consider a support group. This can be very helpful with others who are going through what you're going through. So there are many online supports out there in the community. There's also VA peer support. Here are some resources that we know are out there that are excellent. There's PTSD and family resources through PTS Family Coach. Psych Armor at learn.psycharmor.org has a lot of great programming for families and individuals on understanding PTSD. And it's really great to give you a short synopsis on really having an understanding. But again, going to these mobile apps at ptsd.va.gov on the apps here, a lot of great mobile apps that can be useful to both you as an individual and your family. And understanding PTSD, that guide for family and friends, really helps give the supporting understanding for the whole family view. The In Transition program is a DoD program that can assist transitioning military and veterans regardless of discharge status. It's 24/7 and free. And if you are going through a circumstance where you need, as a military or veteran, you need to get connected to care, you can call them and they can help you get connected via a coach to a mental health provider, either out in the community or within the VA. And Vets for Warriors is a 24/7 free military support program staffed by veterans. You can call at any time and speak with a veteran peer and get help and get supportive resources. So if you're struggling through any of these resources even and don't know what's right for you, or you're struggling at any given time and you are not in an active crisis, you can call that support line and they can help you. Here's some other really great resources just to be mindful of. These come from the deploymentpsych.org military family resources. I encourage you to take a look at these. These are really great for some PTSD resources. The Center for Study on Traumatic Stress has a lot of great resources. These are some of the other ones. After deployment, wellness resources for family and military communities, including family and friends, Blue Star families founded by military spouses, Center for Study of Post-Traumatic Stress again. Again, I encourage you to take a look through these if you are looking for some supportive resources. Coaching into Care. This is a national telephone service offered by the VA to help educate and support and empower family members. So this is a great line to have if you're a family member and you're seeking more information or support on PTSD. Focus is Families Overcoming Under Stress, provides resiliency training to military children, families, and couples. Focus World is a site that offers an online version of Focus military family resilience training. Give an Hour is a free program where if you're looking for a provider, and you need help with getting connected to a provider, they will help you get connected to someone at no cost. And this is generally if you are struggling financially or you need support, but they also do have community providers who give back and provide this. They do not do emergency care. So again, if you're in a crisis, you're going to want to use that 988 number. Hidden Heroes is a national registry of military caregivers to connect them to helpful resources. Make the Connection is an online resource designed to help connect veterans and their family members and friends to information and resources. Military Family Research Institute conducts research on issues affecting military and families, and it writes policies. Military One Source is a DoD-funded program and has a great plethora of information, again, to support military and military families. The National Center for PTSD is one of the world leading research groups in educating and understanding PTSD. Have a lot of great resources as well. National Military Family Association is a go-to for administration, officials, members of Congress, and key decision makers when they really look to understand issues facing military. The National Veterans Foundation has crisis management information for military veterans and their families. Program of Comprehensive Assistance for Family Caregivers. This is a VA program that offers support and resources to caregivers post 9/11. Today's Military is a website offering information and resources for decision-making and guidance to family members and educators. And then it's important to note that there are vet centers out there that are storefront counseling centers embedded in communities. There is the VA Veteran Crisis Line, that 988 number that is also 1-800-273-TALK, but you can text to 988. That is the new DoD VA suicide prevention number, 24/7, 365, and for any crises. And then the Yellow Ribbon Integration Program. It's a effort to promote way building on the National Guard and Reserve members and their families through the deployment cycle. So again, we really appreciate you joining us for this webinar. We understand that you have many options out there with PTSD resources, and it can be overwhelming, but education and awareness are key components to getting on the healing journey with PTSD. And we encourage you to utilize those resources, and you can reach out to us if you have any questions or you have any additional information you're seeking with the resources. Again, thank you for joining us, and we appreciate you being a part of our webinar.